we've talked about some of the benefits now about a National Healthcare Decisions Day. Are there any concerns that Respecting Choices might have about a one-day event like this? You know, we've talked a lot about this awareness. Is that enough?
Well, I think we probably have talked about some of our philosophy here is that, for example, organizations who would do a one-day event and they would have people come together to sign the document and not develop a follow-up plan.
Mm-hmm.
There's one thing for me to create my preferences and to get it witnessed, but the follow-up plan would mean, how do I talk to my family? How do I open that door with them? How do I talk to my physician if I want to make sure that my physician knows what my preferences are? So the concern about it just being that day and there's no further work
Mm-hmm.
that
Okay.
needs to be done would certainly be a concern that we would have. And again, some people would just as soon see it as just an event and get the paperwork completed, but communities can really open that door for there's more work that you can do. This is a good beginning. What else can you do and where can you go in our community to get more help? So I think that would be one of our concerns.
Okay.
I think another is, well, okay, I've done this planning, I've talked with my family, I've actually even documented. What do I do with the document? Am I assured that when this document is needed, my doctors will have it, will know about it, will consider it, will involve the people I want involved to make decisions,
Sure.
and ultimately will honor it. And so there's, you know, if I talked with my family and I got to the hospital and the physician said, well, that's not really important, whether they said it directly or indirectly, and pretty much ignored all of that previous planning, then there's really no reason to do it. So I think on Healthcare Decision Day, we need to be focused on not just how do we do the planning, how do we document the planning, but developing systems within our healthcare organizations to make sure these documents are available, that really compel doctors to look at them, to consider them, to talk with the people we've appointed, and to do their best to make sure that the kinds of plans and preferences and values we have expressed are incorporated in the actual decisions when they're made.
Sure.
If we can't accomplish that ultimate thing, then all of the planning up front is maybe fun to do or maybe not fun to do, but it's not of any great help unless it actually functions at the bedside of the individual.
I think that's one of the things that we've always been concerned about at Respecting Choices, that people would take a document and think that all they have to do is complete it and their work is done. And so we've taken great steps to train individuals that we call advanced care planning facilitators to help people walk through that process and then in the end complete a document that does represent, you know, their preferences. We are always concerned about the false sense of security that people who just complete a document
Mm-hmm.
feel like they have. We hear comments like, well, I've done that, I've taken care of that, and we really know that many times they haven't had discussions, they haven't been thoughtful about who they would pick as their healthcare agent, and many times they haven't even talked to that individual. But if they complete the document, they feel like their work is done. And advanced care planning facilitators and some of the engagement strategies that folks can think about is to, you know, help people see that this is more work than maybe they thought it was, and they may need more help
Mm-hmm.
because many times the documents themselves don't guide people through these really important decisions. And that's, I think, one of our big fears is that people will complete the document, think they've done a really good thing,
Mm-hmm.
and then put it aside and no one helps them see the bigger picture.
Right. And then I think there has to be an added message. You know, this is what you should be thinking about now, and this is what you might want to discuss and so forth. But we also need to remind people that this isn't a one-time deal, that as people get sicker and
Mm-hmm.
older over time, they need to come back to this discussion. So as a healthy adult, we all should be engaged in what we like to call basic planning, picking a healthcare agent, looking at severe neurologic injuries, and then looking at those special important beliefs that we have that affect our healthcare decision making. But if I now have very serious congestive heart failure or end-stage renal disease, Now the course for the rest of my life is a little bit clearer in terms of what kinds of medical treatments I may need, and I now need to start to consider if those things are actually, those kinds of treatments are things that I actually want, particularly as I get to the end stages of a particular kind of illness. I really need to be talking about very specific decisions and probably getting those decisions or preferences I have recorded somehow as a physician's order. So if I'm in a nursing home, for example, or if I'm going into hospice, now the basic advance directive isn't enough, and I have to do more. So the Healthcare Decisions Day, while it is likely to be focused on basic planning for the whole community and all of adults in it, also needs to remind people they need to update these kinds of plans. And in fact, I think it needs to tell people, if you already are in a severe state of health and you're not going to recover from that, you probably should already be beginning to speak with your physician about these issues or seek some other kind of help, so you become clear about what your choices are and evaluate whether those choices are something, what kind of treatment you want when your health fails even more. Mm-hmm. I think I just want to underline one thing that Linda said earlier. The Healthcare Decisions Day, I think, is a wonderful opportunity to further engage the community, and there's lots of ways to do that. But I think healthcare organizations should not think of this, well, got that task checked off, we addressed that, and now let's move on to other things. Advanced care planning is truly an ongoing process, which should be part of the daily work in communities all the time. And while it's great to have this date to bring some additional light to it and maybe more of a community focus, unless it's an ongoing process and part of the routine of healthcare, we won't achieve the kinds of outcomes that are really needed.
And I would agree that I think it's the outcomes. What are we really hoping to achieve here? Mm-hmm. If our only goal is to complete documents and celebrate how many documents get completed, we're going to miss the boat. But if we look at what we want this to do is help people be able to articulate their goals and values, and then have the healthcare organizations say, and we will do everything we can to help honor those. Those should be some of the ultimate outcomes that people keep in the forefront as they're doing other activities.